On this episode of Candid Conversations with Dr. Kelly, I speak with Dr. Jeff Holloway, a pediatric sports medicine physician who specializes in concussion care. We discuss gaps in medical training, why proper referrals matter, and how to advocate for yourself or your child when the answers aren't clear. He's not a one pill fits all kind of doctor. He listens, he educates, and he's here to empower you with the truth. We're also talking about the hype around guardian caps, Q collars, and whether they are as effective as people think. This is the episode every parent, coach, and athlete needs to hear. So without further ado, let's get into it. Okay, welcome to another episode of Candid Conversations. Thank you so much, Dr. Jeff Holloway, for joining us.
Yes, thank you for having me.
It is my absolute pleasure. So I always like to start off with letting the guests introduce themselves. So will you please tell listeners a little bit about yourself?
Yes, so I'm a pediatric sports medicine doctor in Columbia, South Carolina. So that meant I did a training as a pediatrician and then an extra fellowship in sports medicine. And now I help run the concussion clinic, um, taking care of youth that have sustained a concussion from athletes all the way to car accidents or falls, that sort of thing.
What led you down the path of that specialty?
Yeah, so when I originally went to med school, I was very interested in orthopedics, but there's a big surgical component of that, and I quickly found out I didn't like surgery that much, and I liked interacting with my patients more. And then a doctor kind of told me about the opportunity to do sports medicine, which is non-surgical, dealing with all aspects of the athlete, from musculoskeletal injuries to heat illness to just even being sick as an athlete, how that's a little bit different than general care. And so that was very interesting. And then I went into that. And then I started working in an orthopedic office, kind of doing a little bit of everything, but concussion was kind of given to me as my main focus. And that was mostly because most of the other guys didn't want to do it. And I quickly learned that I didn't get trained that much in concussion. And so then it was became something that I had to push hard to kind of learn and understand some of those things. And then from that, just building a passion and understanding that there was a gap there that needed further, further investigation, further development. And I went on to kind of focus on that, and being one of the main things that I do now is trying to not only take care of individual athletes, but looking at concussion care in general from all aspects, from schools all the way up to the legislative aspects of it.
Wonderful. So you said that there was a bit of a gap. So could you tell me what is the training that physicians or medical students do receive for concussion?
Yeah, so back when I was training, which was, longer ago, about 15 years ago, when I got training in my fellowship that again was sports related, there was very little about concussion care other than recognizing it and then just kind of saying it'll go away. So very much similar to, how we dealt with colds, or even during COVID where we were thinking, okay, this is just basic, it'll go away. But then we've learned a lot more since then about how complicated it can be, how the nuances of rehabilitation can be. And so I think that's where that was severely lacking. And I remember specifically one patient that was referred to me from another doctor who had been basically doing that, where they were educating them on concussion. They were sitting out doing what we thought was the right thing, but they were 6 weeks into their symptoms and they referred them to me. And I was like, I had no other treatment plan other than, okay, well, yeah, just keep waiting. And so that's, back then, that's when I realized we had to kind of change our mindset and come up with a game plan to get people back on the right path, that they were kind of spiraling in that pathophysiological process of a concussion, and also trying to figure out objective ways to assess where they're at to get back. And so that kind of referral to me, where I didn't really have any game plan, was when I realized I needed more people involved, more abilities to help assess them, and pathways to help treat them. And ever since then, I've been trying to build off of that and come up with different game plans, and then meeting different people that have passion about it and understanding from the various walks of life, from, again, from areas very much that you're understanding of the therapies, speech therapy, occupational therapy, physical therapy, but also from the school standpoint and the coaching and athletic training world, to better understand what that game plan looks like too. So we're not cookie cutter treating every concussion the same, because as we like to say, if you've seen one concussion, you've seen one concussion. So knowing that and the uniqueness of that is a big thing that we like to look at now.
So, what did that training look like? The extra piece you talked. It sounded like you had a lot of interprofessional collaboration and meeting of the minds. Was there any sort of like course that you took or exam or anything like that?
Not anything formal. Really, the only thing I found was out of Canada. There was some concussion trainings that they had developed, trying to give people kind of certificate of understanding. Some of the ability to use testing came along with some training, where they realized that if you wanted to use this tool like a computer test, you probably should be trained somewhat in that along with the bigger picture. So you're not just using that computer test as the one assessment that tells you everything. So there was little bits of training here and there. And then I do think it was a mixture of, reaching out to people, seeing what they got, and then a lot of it was coming up with a game plan and then figuring out those gaps on the aspect, and then trying to provide CME from, from a medical standpoint, to provide education out there about some of the basics, because I felt like we weren't getting the basics right all the time either. And so trying to just go off of that was really the main thing. And unfortunately, there was no training. Now, there are some doctors, there's neurologists that get trained in concussion specifically, but there's also neurologists that have never been trained in concussion because they never took a fellowship or worked in an environment where concussion was done. And so similar to here is they rarely get training. But I've also then tried to connect back to, say, the child psychiatrists, and they now get a lecture from me just to give them the perspective that I've learned. So trying to kind of close that loop back, so there's not the deficits like there was in the past.
Okay. Well, that is noble work. Thank you for the lectures that you do provide. So you mentioned the basics. What are the basics on the physician side for that?
Yeah, so I think, again, from the physician side, we're rarely, on the sideline. So that is obviously one thing that is an important thing, is recognition, understanding. I do think sometimes in the ERs, them understanding when to recognize it, because someone might come in having hit their head, but really their eye is their biggest complaint, or they got their tooth knocked out. And so really the doctors are dealing with that, but not thinking of big picture of that they could be having a concussion underneath. So I think at least that is a very basic idea of making sure that people are aware that that's a possibility, because the symptoms don't have to be there right away. They can come out the next day. They can come out as you do more. So understanding that aspect is very important. And then more from the basics, almost from the primary care doctors, is making sure we don't use our old training of, or old mindset of, just rest is best, and that it'll just go away, because there's more and more data saying people that actually go back to school do better as long as there's accommodations. People that do exercise do better as long as they're not doing anything dangerous or over the top, making their symptoms worse. So I think those are some of the basics that we see don't get applied. And then a lot of times I'll see people down the road, when, similar to if you broke your foot, if you just walked on it for 6 weeks, well, now we're dealing with a different entity than if we dealt with it early on, eased off of it, walked back on it. and both ways, right? So like you could either stay off of your foot and have really trouble going back on it, or you walk on it too much and then it doesn't heal right. So that's I think where the basics of concussion is understanding it from that aspect, but also realizing concussion might be the most complex injury that a patient can have because it's your brain, which is luckily the most complex organ you have.
Absolutely. So I share with people that we are in a silent epidemic. And last year, I saw some data that said that we are up 1 million in concussions. And they said that basically like secondary injuries are being missed in the ER, and so patients will get sent home, and then they'll still experience symptoms, those secondary injuries, days or weeks, and sometimes months later. What would you say to listeners on what should they do if they are still seeing symptoms? When should they go back to the doctor or the hospital?
Yeah, and I think that's again when to go back versus when to seek further treatment is kind of two different things. So when to go back to the ER, obviously the ER is there to help make sure you're not dying. So when you go back and say, "Hey, I still have some headaches," they are not equipped and built for that uh, complaint, right? So then primary care doctors often will try to kind of hierarchy you of like how bad is it? Can we wait? Because they don't want to overload the specialists with a bunch of people that might go away. So again, from a cold standpoint, we don't want to send every cold to an infectious disease doctor. But when there's certain things, um, I think if anytime you feel like it's not getting better, you are the your voice as the parent or guardian and the patient themselves should speak up and say this isn't getting better because unfortunately we don't have any easy ways, and that's like what you were saying, it's a silent kind of problem where there's no visual obvious that you're having these headaches that are ongoing. And I think again the biggest push I would say is trying to say that by you pushing through it you're now making it harder to recover in the long run. So again, there's a lot of data about pushing through it. And obviously, right away, they say you're 8 times more likely to have long term problems if you go back into playing right away. And then obviously, there's the idea that you just kind of keep running on a broken leg. You just keep pushing your brain too hard. It's going to try to figure out ways around that. And then you start developing issues that aren't really necessarily the concussion anymore, but just kind of loopholes in there about poor sleep, poor attitudes, poor grades, that all are related to it. And that kind of spirals even worse. So you kind of add layers onto it that make it more difficult the longer you wait. So I think speaking up as soon as you can is ideal.
What would you say to parents or athletes, just any patient that you would see or their caregivers? How would you recommend that they advocate for themselves when they're actually in the exam room with the doctor? Because not all doctors are, an expert like you are. And so I've heard stories of people I've interviewed who have said that, a doctor has said, well, you're just in here because of that movie Concussion. And,
Mm-hmm.
there's nothing really that's going on. How
Mm-hmm.
do, and, with the white coat syndrome and all of that, people just take that at face value. And there may be parents who aren't well versed to say, no, this is what's happening, or ask for a second opinion. How can they advocate while they're in the examination room?
Yeah, I definitely think that's a very hard situation sometimes when you are trying to say something and someone's trying to almost explain it away. I think I think having the attitude that most doctors are there to help you. So if you have that attitude, then you're more willing to kind of re-examine it and say, but are you sure? I do think sometimes it's almost like that idea and why you hear a lot of commercials say, hey, ask your doctor about this because doctors don't always know what's out there and what's available. And so I've heard all the time that just the other day, actually last week, one of my patients went to their pediatrician and they said, I don't think anything's, major we need to do. And they were like, do you think that we need to go to the concussion clinic? And they were like, oh, well, maybe what's that? and they didn't even know it existed because they live in a smaller area. And then the funny thing about that was that family is from Greenville, and that doctor I think just Googled and found me, and so sent them all the way to me when there's a concussion clinic in Greenville that I helped start too. So I was like, well, you could go back there because it's more convenient. But the fact that they skipped them, more regional, just shows you that idea of lack of understanding. And so that mom just unfortunately happened to know about it because she had researched a lot with her previous, or her unfortunately had a previous experience because her daughter had experienced a TBI that needed a lot more care. So she got the more extreme TBI that needed all the care. So she knew things were out there and there was opportunities for improvement. So she thought, well, can't we apply that to my son's mild traumatic brain injury that's lasting longer and keeping him from going to school? And so that's again, I think an important aspect of just maybe evaluating, but also just keep asking, and then that's where we also have had people just call us up and then ask, and then we just have to kind of say, okay, go back to your doctor and ask for a referral because we'll definitely see you.
Okay. So I recommend that student athletes, that they just ask for a speech therapy order
Mm-hmm.
because at least you'll have one,
Yep.
versus having to go through the dance of explaining and either having a doctor believe you or not, but at
Mm-hmm.
least they'll have it in um, on the side if they need it. And I'd rather them have it and not need it than not need it and then, or excuse me, or not have it and then they need it.
Right.
So when you and I met, we met last year at the Brain Injury Association of South Carolina. You were giving a talk. And one of the questions that I asked you was, how often are you referring to a speech therapist? So we are a part of the specialist in, cognitive rehabilitation, but a lot of doctors are not aware of that. So could you speak to what your knowledge base was of speech therapists prior to us speaking?
Yeah, so I definitely knew of it as again, we kind of think of the combo of speech therapy, occupational therapy, physical therapy kind of all overlapping in ways, but having specialists pieces to, again, your brain, what domain is being affected. So obviously speech can be the actual speech, but also from the cognitive ability to communicate and learn. And so at least in my small world of concussion specialists, the occupational therapy did more of the cognitive part. And so I think that's where at least speech therapists that I had talked to before speaking with you were more not trained in concussion and just, they did more um, feeding issues or speech that was unrelated to TBIs. And those all kind of got funneled to the occupational therapists who did more TBI related activities. And so I think I just think back to my physical therapy days, or before I started really working with physical therapists. It was a very similar idea that I knew physical therapy was a thing, reading it in articles and studies that proved vestibular therapy could be helpful and exertional therapy could be helpful. And so when I first started, I tried to reach out and I told a family like this could be helpful. Why don't you ask if this group that you could go to that's in town for your town, if you could go and try it? And they said, okay. And so I gave them the prescription for it. They went and then they came back and saw me and I was like, and they said, I don't think they know what they're doing. And I was like, what do you mean? They were like, well, they didn't do what you described of being like rehabilitative. They just threw her on a treadmill and she ran until she puked. And so I thought, well, this is not good. Like they thought they were getting the right care and yet they were actually being harmful. So that made me really take that step back and realize that not every therapist is trained the same and not everyone has their passion. But unfortunately, sometimes people will try to help but not know how to help. And I think that's a part that, again, did they have their best interest? I think there was just a kind of a naiveness to it all. And so I think the same thing is always applied to the other ones too, where someone will say, hey, I have this speech therapist. And then when I start to ask him, okay, well, who do they work with? How do they, get patients? And so when I hear, well, they're connected to this or that, or they do this type of assessment, then I better understand that, yeah, this is a person that I can trust to have them evaluate them and decide. And I think going back to your point would be you would hope that a speech therapist would get a referral that or have someone come in with a prescription and they would see that it said for TBI and they go, oh, okay, well that's not my world even. Not even that I'm not the expert on it, but I just don't understand that. So like here's a person to understand. And so you would hope that there'd be layers of that to like navigate the system to see the right people. And so I think that's where we always make sure people kind of re-educate. And then I would hope that any speech therapist too would then probably want to say, well, who's seeing you for the global care, right? So if you just go see a speech therapist and they're not thinking of all aspects because again, there's so many pieces to the puzzle, then I would say you're probably not seeing someone that can really help you because they're only helping a one color of the rainbow of issues.
I like that one color of the rainbow. And you mentioned that in your area that it's even hard to find a speech therapist who would specialize like this. So could you
Yeah.
speak to those challenges?
Yeah, and some of this is talking directly to the manager at our specialist physical therapy group. He was just saying, our we have a speech therapist, but they are not they don't see it on a regular basis. And so I have had a couple patients in the past that again, because their main problem was actual speech and stutter, that they took them on, but they again probably are very much hitting the surface of the problem instead of dealing with all aspects. And again, would then get the occupational therapist involved in that situation. So they'd kind of add them on. So they work more as a team. And so I think that's where, again, thinking through that aspect of, sometimes we can say this is your one problem here, everything else looks good. But sometimes it's a little bit of all those colors that we got to deal with, and I think that's when it gets hard too, because obviously we don't want to send someone to a speech therapist, occupational therapist, physical therapist, see me, then they can't go to school ever. And so it's a complicated thing. So a lot of it is a navigating the system as you get better, what things can go away. And so I think even better too is I love when a therapist says, well, I'll see you and decide if if I if you need me, right? Because maybe you don't, because the concussion is supposedly going to be fleeting, and you maybe only need to see him once or twice versus signing up for a 8-week program when it's going to go away in a couple weeks type thing.
So that is the, rehabilitative side where professionals are actually putting hands on or interacting. When would you prescribe medicinal intervention for a patient?
Yeah, so I hate prescribing medicines in general because I know it can make things worse. And so when I think about prescribing medicines, I try to think of it being a very specific limiting factor of everything. So headaches, I think, is a great example where if I had someone that was seeing you, for instance, and then every time they came to see you, their headache was so bad that it was hard for you to do anything with them because they already started at a baseline headache, then I think that's when medication is now more beneficial than risky because I can lower that threshold and they can rehab back. So again, using a musculoskeletal thing as an example, if it hurts too bad to walk on it, obviously we want to just cover it up and say everything is fine, but we're trying to say here's a little bit of medication that could help the inflammation so you can walk more, and then that will allow you to rehabilitate back and then fix the problem. I think the other big category is when someone has baseline problems that were always there, so things like ADHD, and they weren't bad enough to need medicine, But now the concussion has added extra pieces to the puzzle. Your brain's over there dealing with helping the concussion heal. So maybe we need a little boost and help your ADHD aspect while we rehabilitate you. So again, a short-term treatment plan that would bring down those symptoms so you can concentrate and feel better. And surprisingly, there's a lot of studies that have shown that treating things like with even depression, ADHD, those have downstream effects of helping things like headache. So what you would never give someone with migraines and ADHD medicine, but in concussion, sometimes treating the not just the symptom but the root problem is key with medication. So those are usually the two biggest points I use to treat with medications is when there's significant dysfunction or baseline issues.
I think that it's great that you are also not a here's the pill for the rest of your life, and that you talk about, taking them off of it when it's warranted.
Right.
So we all do continuing education units and go to conferences. And of course, I'm always in anything TBI concussion related that I can get my hands on when I go to these conferences. And one of the ones that I went to in December of last year was about, well, they had this interesting stat that talked about the TBI to prison pipeline in schools. And they said that a lot of the time, um, students and young people that end up with diagnosis of ODD or ADHD, a lot of times they have a history of concussion or brain injury, but it may not be reported. And so they are experiencing misdiagnosis to where they may show signs that could align with a certain behavior that would, get a diagnosis of ODD or something, but they, have had a television fall on their head at home or something, and the parents didn't really put two and two together. Have you seen anything like that where maybe something doesn't quite align with the diagnosis that is in the chart?
Yes, unfortunately, I do think there's some correlation between those type of things. Again, similar to how I was talking about things kind of spiraling, I think this is where can you say it completely caused their issues, or did it magnify them, or did it put you in this weird situation where you aren't able to regulate it like you could before? And then once it gets out of whack, then other things, factors come into play, and it can really downstream. And so I often get a complaint even from a young kids that their emotional dysregulation is off. And so obviously if your emotional dysregulation is off and then you're living amongst other people that aren't completely helping you out and doing everything like you want them to, then you're gonna yell at them or spit off, and then that interaction is now going to lead to something, so a fight or something like that. And then obviously the downstream effect would be they would be into the juvenile system. And then there's the data about, once you're in the system, it's hard to get out of the system, or now, that is one of the biggest risk factors for being back into it. So really the concussion has gone away, but now you've had these one step removed that really added problems. And so I think that's where, again, trying to address it early on is the key, because, down the stream, it's really hard to go back because the concussion can be long gone, but now you've left with the detrimental effects. And so I think that's where early intervention to try to prevent from going down that path, and your brain kind of figuring out ways to deal with it is very important. And again, that's where certainly medications can be of use to try to prevent some of that, where it becomes a very dysfunctional aspect to it all. And obviously my other world of work is as in the juvenile justice system, just as a general doctor, and that was something I got into kind of randomly, but the overlap with concussion has been very, very eye-opening. Again, talking to kids and just realizing that often they aren't in situations to easily see a doctor afterwards. And again, some of them are athletic injuries, but some of them are, like you said, just accidents or incidences, and making sure that they're dealt with completely, because once they're here, and I've had some doctors, ask, one kid had a TBI when he was very young, and so did that influence how he is now? Well, possibly, but it also is a completely different entity than an acute concussion.
Absolutely. I think it's great that you're doing work in that space. I've only heard of a couple of places, California and Illinois, who now have speech therapists that go and work there full time, because I have heard that, with the concussion or brain injury, or, even just young people who come from lower socioeconomic backgrounds, or the schooling isn't as good, and so some of them don't even understand what they are incarcerated for or what they're
Hmm.
standing trial for. So I commend you for that work.
Yes.
When you and I spoke initially, we talked about how um, if every like just basically that it was a shock to me to learn that not all doctors are well versed in concussion. And so that makes me wonder, what is the difference of going to primary care who may not know much about it, or an ER doc, versus coming to see you? What is the difference in that experience?
Yeah, and again, I think that's where ER doctors are trained in things that I can never do. Um, and so knowing that the system is built that way, right, to have that hierarchy where you might have to see the ER and then your primary care and then me. But that's also just how it is for most things. But I would say the biggest difference is the amount of time that I have to spend with the patient. So a primary care doctor, and some of this again goes into just how things are, where when I was in the sports medicine world more, we were operating very much on a quick turnaround of patients because we were trying to do a lot of little things instead of in depth with the patients. And so I think just how the structure is, where my visits are built to have 30 minutes to an hour versus 15 minutes in a primary care or orthopedic office. And so we can't treat them the same as an ankle sprain or a possible break that they're fine. We have to really indulge into the nuances of their concussion and educate them on the different pieces of the puzzle, and guide them along the way. Now, that being said, I don't think there's anything that says that we couldn't train primary care doctors to better triage them and treat it. And one kind of thing that frustrates me a little bit is sometimes they'll see a primary care doctor and they, similar to like someone that was worried that they broke their hand, would refer them to us, but they wouldn't get in to see us for a week or two. But for those week or two, they're not being treated. And so, similar to if you worried that you broke your hand, you should splint it. With a concussion, well, you should get accommodations to give to the school to say, hey, I had a concussion. I shouldn't be doing PE and risk re injury. I should get extra time. I should probably be able to take a break if my brain is overloaded. I should be treated differently than the kid that just doesn't want to do school because I currently have a medical condition. And so I think that is some low hanging fruit that we could much improve. And I think that's where, again, the Brain Injury Association and those groups, and obviously you trying to educate people, is part of that. One of the main things I think that we can make a big difference on is making sure people do that piece. And that piece would help most patients, and most concussions I don't think need to technically see me, because I would do the same thing as the other doctor would as long as they were trained, if that makes sense.
Yes, absolutely. So, of course, my through Brain Talk Foundation and Brain Talk Day, the whole point is to raise awareness, because, as you just said, the trickle down of ER, possibly then PCP, and then referring to a concussion specialist like yourself. Um, what happens when the awareness isn't there? They get discharged from the ER, and then, you know, they forget to mention to the PCP whenever they go back around, and they don't get the accommodations. And then, it's kind of this domino effect where if they don't have the knowledge or the awareness to advocate for themselves or remember to even look for these signs and symptoms to report, they could end up with a misdiagnosis, or the possibilities are endless of where that awareness, if the awareness is not there. Could you explain what happens when a patient does finally get in with you? What does that visit look like?
Yeah, so it varies a little bit based on like the timing, and then obviously athletes, they're treated. I try not, again, we don't try to treat athletes different just because they're athletes, but they have a different game plan because they're trying to go back into a game, which would definitely risk injury. And so that those patients will sometimes have a different game plan. The We right now have a day where we have a physical therapist and me working together, so we try to triage the patients into fitting into that day. So some of that's the age of the patient because younger kids, again, can't do some of the testing that we do just from not having baselines of it, but also just understanding how to, stand on one foot and balance, and all that stuff can be different for 10 and under versus 10 and above. And so in those visits, they'll see a physical therapist who's looking at it from the physical aspect, deciding if therapy, early intervention can be helpful. And more data is saying that it can be. So again, an athlete that wants to get back to playing as safe and as soon as possible, therapy can be beneficial if their vestibular, ocular balance is all off, because that system isn't going to get better just sitting around doing nothing. So there, again, exertion it and training it back can be very helpful. Then I always think of myself as kind of evaluating all aspects, all colors of the rainbow, trying to figure out if there's ways to do that. That can be, again, talking through what's bothering them the most, and again, headaches being something that's often there, but is it headaches every day, or is it spiking in headaches? And that's where we try to think through a game plan for that. And we basically go through a list of their symptoms that they're filling out a symptom score, and then based off that, going down paths of treatment, which again would sometimes be, hey, these are available. Do we wait and give it time, which is, roughly 2 to 3 weeks, we think is that time where we're going to give it a good chance to heal. But if it's not, then obviously we got to do something. Or if we had these pre-morbid conditions that now are affected, that we got to just go ahead and treat. We are exploring more and more options of objective testing. So there's apps that one's called Sportgate, which is where you would download the app, and then it would have you walk with your phone, and then that would tell you about balance and gait and how stable you are. That one is tough without a baseline to know exactly what's right, because everyone walks a little bit different. And so we are trying to push hard for schools and teams and things to have some baseline. So when we do that test, we would be comparing you to you, and apples to apples, not apples to oranges. But we can look at it in general. And then there's also a cognitive piece of that. Uh, and then there's more testing that you could do in that domain. But a lot of it is talking through the situations and what for you is a problem in your concussion, and then coming up with a game plan, with whether that be kind of poignant education or global accommodations at school, and then narrowing it down. So I also talk to them about the journey that it is too, where again, it's not going to be like, you broke your hand, here's your splint, come back in 3 weeks. It's understanding the complexity of it all, but narrowing it down to poignant things. And a couple just basic things that we always try to describe is, again, things like sleep, where your sleep cycle gets off. So trying to go back on the sleep regimen. If that doesn't work, using over-the-counter melatonin can be very helpful. Again, comes along with the risk of nightmares and things like that. So we always have to balance thinking we're doing something good when it can add something new. So we don't need to just blanketly say, do all of this. But then there's even supplements like magnesium, vitamin B that can be helpful. And then it's talking a lot about things that can be harmful, right? Like taking naps, not going to school because it throws off your cycle, taking too much Tylenol, taking Tylenol every day for 3 weeks will cause your headaches to be worse. So trying to get ahead of it so we're not adding new problems is also a big piece of the game plan for sure.
When would you just immediately go to this is a traumatic brain injury versus a concussion?
Yeah, and so some of that, when we start trying to clinically define those things, a lot of it is based on the initial presentation. And the initial presentation is always hazy because someone, there's a trauma involved, so people don't know what was happening. That there's an old adage about seizures and parents asking how long that seizure lasted in a child, where they've witnessed it and it said it felt like eternity, right? And it was only 5 seconds. So you're dealing with just emotions and all that stuff. So defining that is really hard. And then there's the idea of whether or not they find something structural versus functional. And that's where I think one of the biggest misnomers I always have is they went to the ER, got a CT scan, and that was negative. So therefore, there's no problem. But I like to use a computer as an example where if I, or a phone or a laptop, where if you drop it, you could worry that it, in this theory, that the idea of a concussion would be it would like reboot to Windows 95, and now it's trying to work off of that, where when you take a picture and look at it, it all looks, you didn't break it, but the system isn't working like it was, and now it's trying to reboot or reconnect to the internet, and that takes time. But if I sit there and mess with it too much or do something else, it's going to get a lot worse. And so that's again that aspect of understanding the difference is, and I think again that's where language is tough because someone might use the word TBI, but then again, a concussion is a mild traumatic brain injury. But when is it a severe traumatic brain injury? Is like, well, we know that because that's kind of like you're in a coma and in the hospital. And then moderate is like, is that in between? And then a lot of people like to say, well, you just had a mild concussion, but that really is a misnomer because that then you're saying you had a mild traumatic brain injury when what we're trying to define is not the how bad you feel, but just that category of like the initial aspect. And so I do think that's really hard. But obviously, there's people that come to me that were in terrible car accidents that were in the hospital for days and not able to do anything, and then they see me because there's not really a resource great for right then. Um, and so I apply some of the concussion things, but obviously they also need long-term care, which gets into the world of like pediatric rehabilitation doctors. So they call them PM&R doctors. The neurosurgeons are all ones that kind of look at it more longitudinal in the more traumatic brain injury world.
Have you seen kiddos with traumatic brain injuries?
Unfortunately, I have seen a few. Again, with our system in our hospital, most of those do get triaged over to the PM&R rehabilitative people to look at it long term. But I've also had the neurosurgeons ask me to get involved early on just to educate them on some of their minimum treatments of schooling and symptom modification, that sort of stuff. And then obviously I do see a lot of people that also had skull fractures, brain bleeds, but the neurosurgeons are saying that, well, that's structurally it's not a problem. It's similar to again that computer analogy where the screen is cracked, but the screen still works fine. There's just a crack in it. So it's not like it's something that needs surgical intervention, that type of thing. And so those patients I'll see. And then obviously though we're dealing with two different game plans because that person might need to sit out of their sports a lot longer because their skull is cracked versus a concussion that might get better symptom wise over a period of time. And so I think that just takes a lot more teamwork in those aspects too. And then certainly those are ones too where I've seen that I've more quickly referred to therapies because they started getting some basic assessments in the hospital and saying that there were deficits already, so that we really need to start off and get them on the right track.
What advances have you seen recently or in the last few years based, just from when you started in this space to now? I know we've got apps and all that great stuff. What are some of the things you've seen?
Yeah, I think some of the stuff has been like apps that try to help with the communication part. There's one that we're trying to work on and use now that supposedly people can enter in data again from that, like what happened initially. So the patient doesn't come and see me 2 weeks later and tell me, oh yeah, he was fine right when it happened, when there was eyewitnesses that said he was passed out, right? And so, but that again is not them trying to lie to me. He doesn't remember if he passed out or not because he was passed out. And so then the mom wasn't there, and then so adding that informational piece has been, I think, a very important thing. Getting people on board with that has been hard because I think again we don't have a big enough onus that this is a serious silent epidemic, like you were saying, that it is silent in the way that a lot of people don't proactively think about it, because what are the odds it's going to happen? Well, more and more data is saying, well, the odds for an athlete is 20% chance you're going to get a concussion playing sports. So that sounds like something we probably should game plan for early on, have a process. And then I think the advantages has just been more training of specialists and people in the at least recognition of it, to not wave it off or saying, oh, you'll be fine. And then I do think there's more and more technology. I just met with a company that they're trying to use using like EEGs instead of looking for seizures, but more how your brain reacts to visual audio stimuli, and that can look at a brainwave of, again, an objective finding that you can't just say no, I'm fine, or do something in, but an objective finding of, okay, your brain is not reacting to that signal like it should. Again, that type of data gets better and better as they get more and more patients that are baseline, so then they can show what normal is. But again, the hardest part is when someone is slightly off normal, and then they we do that test and it's off. Is that truly showing concussion, or was that issues that would have been there anyway? So I think that's always the challenge with some of these newer things is there's not going to be just like one test that's like, oh, this is obvious, but looking at the the each all the pieces together and what that tells you.
Could you speak to, we're talking about new advancements. Everybody always asks me about this. Um, Guardian caps and sensors in the helmet. What are your thoughts on that?
Yeah, I think I didn't really read details of it. I just saw a headline of the Guardian caps. They were debating, and I thought of it because I had a guy come in and was like really pushing it, saying, why don't we just wear those if they're good? Why don't we wear them? And like he was asking me it as, I think trying to figure out about getting kids back to playing. Like if we just put those on, that would be better. But I always say there's no concussion that's concussion free, right? There's no helmet that's going to keep it because it can't keep your brain from joggling inside. So can those cut down on the risk? Um, Possibly. And I think one of the ones that I've seen more data on was like the bands in the headbands for soccer players. And the debate was, if a girl puts that on, would she be more aggressive because she thinks she's protected, similar to how football players feel more protected with their helmet on than rugby players do because their face is covered. So they feel more invincible. So they actually are going to be more aggressive, which would put them at more risk than what we are trying to accomplish with the band or the caps. But I do think that things like sensors, all of those can be helpful because it's more data about what could be happening. So the sensor being something that could help you because in that situation you could say, well, how bad was the hit? And then, well, that was too bad. So I don't care that you're not reporting any symptoms. That was too bad. You have to sit out because your symptoms might not be coming out yet. Like you might be so concussed you don't even know you're having symptoms type thing. And so I think that can be helpful from that. But on the flip side, I did hear that I think one college implemented it, and then the kids were having a game of who they could set off the alarm on. So in
With
practice,
the
they're
sensors?
right. So the teammates were trying to hit each other hard enough to make it go off. Um, so that's where you have to worry about the technology and how you have it displayed, I guess, because to them it was the game of let me light you up to literally make your light go on, and that means I hit harder than this guy. Again, that's a hopefully a one-off that doesn't happen all the time. But I think that's where again education behind why we're doing something and not just doing it is an important thing too, because obviously those kids didn't understand the whole point of it.
Oh my goodness. I see those things on social media. Like I've seen where um, young football players are putting their helmets on and I don't know, taking a towel or something and just smacking the back of the helmet just as hard as they possibly can. And I'm like,
Yeah.
potential unnecessary concussion as a game.
Yes. Yeah. One of the other technologies I think is someone was asking me about recently is the Q collar. And that one, for those that had never heard of it or seen it, is basically a collar that you would wear around your neck. That how it works is it's actually putting pressure on the venous system in your neck to keep more fluid in your brain. And so to me, it sounds really wacky at first because you're like, well, that sounds like it's like choking you to help. The idea is it's just enough to allow a little bit extra cushion in the brain. It again, I haven't seen anything great that says it's earth shattering and needs to be done. I think lacrosse players is one of the ones that was targeting the most. And I do know that like professional players like Luke Kuechly, who had a lot of concussions in his career, started wearing one. Again, thinking as I'm trying to continue to do a sport I love and I get paid for, how can I do it? So I'm going to add in something extra. But should any just random kid start wearing that, I think that's where it gets debatable.
Yeah, and a lot of young people looking up to the professional athletes and not understanding the difference. And even in the session that I attended last year that I was telling you about, they were showing that, concussions can be even more detrimental to kids than to adults, when originally the thought was kids have neuroplasticity and so they'll bounce back faster. But the talking about how structurally, anatomically, their necks and shoulders, which of course works on the stabilization of your head and brain if and when you take a hit, that they're being impacted more because they don't have the completely developed neck and shoulder there to support. So that's interesting with the Q collar.
Yeah. And I think also the idea of the kids not recovering is their brain is already trying to figure things out. So you just added a lot more complicated pathways that it's trying to figure out. There's an interesting diagram I show people. Try not to show everyone because it shows that idea of how complex it can be. So I don't want to scare people or make people overthink it, but it's called the dynamics of concussion, and it's all these connecting points. Again, starting from the cellular level of what happens when the hit happens and the everything changes structurally, but also the feedback loops of again stress and things like that. That stress on anyone's brain isn't good, let alone a traumatic brain. And so that complicated component, I think in kids, they're already trying to work out that those knots and things like there's those games where you're trying to undo knots and a big ball of yarn together. They're already trying to do that to get their personality and their thought process and not overreacting to things. And then you have this extra stuff come in, and so I think that's where it's so complicated. So other than the like orthopedic injuries where kids will bounce back so much faster than adults, the brain, I think, is already trying to figure things out, and now you're adding a lot of complex components. So I think for sure educating people on that, where again they see in the NFL that a player gets a concussion and is back the next week. Well, the average recovery time in adults is about a week. So that makes sense when more and more data is saying the average concussion recovery in a child is more like a month. And I think that understanding is an important thing too, because again, if you're a few weeks left of your season when you have a concussion, I would hope that more and more people would say you are not playing the rest of the year, but go see the doctor to check on how to make you feel better and function as a person. But I get a lot of kids coming into my office saying, "I got my last football game's tomorrow. Can I go back?" And then I go, "Oh, well, you're feeling fine." And the mom's like, "No, he still has all these headaches and stuff, but they wanted us to come get cleared." And I'm like, "Well, I don't understand why that's a thing." But it's just this mindset of getting back. And again, I think that's where the education part can be helpful, and then like starting the process, because a lot of patients do think they're just coming to get, I feel like, a magic wand rubbed over them to be cleared. And I'm like, well, that's not possible, and that's not even practical. And I wouldn't even begin talking about getting cleared in this situation, because it's more about making sure you don't have lifelong headaches at this point, in their situation where they're still having headaches.
That is music to my ears that you are intentional about that. I've heard stories of parents who will take their kids to their friends who are doctors and say, can you clear them or can you write them out? I do see in North Carolina, at least within the Charlotte Mecklenburg school system, they require the same doctor that they were originally diagnosed with, they have to be the ones to clear them. So that kind of puts safety guards in place so that parents can't take them to friends for them to get cleared. So,
Oh, that's interesting. I never heard of that, but I unfortunately have heard of dermatology friends clearing people for concussions and stuff like that, because they all it needs is a doctor's note. And that's again one of my, hopefully, uh, things I can change is trying to work on the law a little bit. And then some of that, again, they didn't want it in the law to say it had to see someone that's trained, because, like we were talking about earlier, there's no way to prove that you were trained in concussion. And so they were afraid of that. And then access to care, because every person can't come see the people, that do it every day. And then, but I think, like what you were saying, is that if, as long as the person that knew the most information is also the one clearing you, they're very much more likely to have the best interest and understanding of the situation. Versus, I personally had one kid I told I wasn't clearing them, and the dad was very upset, so he went to urgent care down the street and got cleared. And luckily, the athletic trainer knew me really well. So again, having a relationship and a thing, it's just, they called me and they said, "Well, what do I do? Because you told me they're not cleared, but they got cleared." And I was like, "Well, again, all the law says is they have to be cleared, and so he's cleared." But we had actually written for that school a policy that said you had to do the return to play. So while he was, stamped cleared to play, the school policy said he had to do a return to play. So there's no way he could play that night, because he had to do drills and a non-contact practice before getting back. So I think having those policies, procedures in place can also prevent some of those issues. So individual schools have to take that ownership on. Individual people at the school have to make sure that those policies and procedures are in place. And that can be, school nurses and school officials, because they should all be part of that also.
absolutely. And the parents themselves, because like you said, the dad was upset. I am now doing work where I'm on the sideline so I can actually see what some of these protocols look like. And I saw a football player get he got concussed. I mean, the helmet to helmet collision, and he rolled off of the field into the sidelines, and his knees buckled as soon as he stood up. And when they did let him go to walk, because he kind of collapsed into one of the coach's arms, he started walking towards the goal, the football goal,
Mm.
and he was like, "Of course, I'm fine. Put me right back in." And some of the considerations that I heard on the sidelines was, to me, not medical. They
Mm.
were like, well, he's not a senior. And I was like, well, what does that have to do with anything? And they're like, well, it's senior night. And, if he wanted to play a little bit more. And I'm like, oh my goodness,
Yeah,
no.
that shouldn't even be a, yeah.
Not even a thing. And they said, he had just come back from a concussion. And so, of course, in my mind, I'm thinking SIS, and the considerations that were on the sidelines were more cultural and social
Mm.
than medical.
Mm-hmm.
And they looked to me and they were like, what do you think? And I'm shaking my head. I'm like, it's a no-go in my opinion. So when they told the student athlete no, he was really, really upset.
Mm-hmm.
And so I think that is going to be a factor of the training, is being prepared to just have either parents or coaches or athletes upset with you, but realizing that you're potentially saving a life.
Yes. And I would hope that he wouldn't be very upset if we had educated him on the possible risk. I mean, again, that's why kids do some crazy things, because they don't understand that risk benefit ratio of things. But the more, I think, if you could have educated that, I hope, like my own son who's 12, if I told him he couldn't play because of a concussion, he would understand. And while being upset not being able to play, he would understand why I'm doing it, not that I'm being unfair or that I don't have his best interest, because he would understand the risks that are there in that circumstance.
Absolutely. I think we have a long way to go with that. I mean, Brain Talk Day, I want to bring that into the school so that I can kind of have it as I always say it's like my offering, like how DARE was.
Mm-hmm. Mm-hmm. Yeah.
And if I can get kids to just kind of remember the symptoms or even be aware of the risks, because the last football game that I went to last season was at a high school, and it was a night game. Two of the players had on dark sunglasses. And even the way that looks to society, the person I was walking with on the field was like, oh, they think they're hot stuff because they're football players and they're wearing glasses. But in my mind, I'm thinking they're probably concussed. And it
Yeah.
turns out that both of them were
Right.
concussed. They were concussed by one of their teammates who was on the field. And when I spoke to that teammate who concussed his teammates, I asked him about it, and he said he doesn't believe in concussions, and he's been playing since he was in third grade.
Right.
So the awareness piece has to be there, and it's going to take work and people like yourself and myself
Yeah.
to spread that word.
And unfortunately, I've even heard athletic trainers say they don't really believe in concussions. And so that is, again, someone that I hope is soon retired, because of more old school mindset. But they got into a lot of the social component of saying, like, those are kids that just don't want to play and aren't tough enough. And again, it has nothing to do with any of that. Uh, Fortunately, I did have a kid that recently too that was one of the bigger kids, and so the team really relied on him to help protect the quarterback. But he had gotten a concussion, and he came in saying everything was fine. He'd been doing with his trainer, and I always try to just give him the idea of, like, let me just spell it out and just make sure you don't have any questions too, and just have a frank, conversation with them, not just go straight based on the idea that they should be fine. And he just said, I'm scared to go back. And I said, well, why? Like, why? And he's like, well, what if my brain isn't ready to go back? And, that's very insightful from a 12-year-old that, again, was being pushed to get back as fast as he could. And I said, well, if you're uncomfortable going back, let me be the bad guy and say you can't play if you don't want to play. And the mom was on board with it, luckily too. And so I wrote that he couldn't play, but they didn't understand why, because he was fine, he was ready to play. But I said, well, that's not none of their business why you can't play, and I'm never going to tell them that you said you don't want to play. But I think that's the attitude of like someone else would come back and say to him, well, he's just not being tough and wanting to go back. I don't think that was the case because I think he's the biggest kid on the field. I think he just is one of the smartest of understanding the risk benefit of playing and that it's not worth it right now. And I completely agreed with him. So I think more understanding of that, to get people into that position would be helpful for sure.
Absolutely.
Uh,
So, as we wind down, I would love to know what advice you would have, just general advice, like if your kid is going to play, what would you have to say to parents, and then what would you have to say to young people?
yeah. Well, it was funny when you were talking about the sideline and actually you were shaking your head no. There was actually a study that just came out that said observers that see a patient in a football game that get up and shake their head, that is actually very diagnostic of a concussion, which they found was to me fascinating because how often that happens. And so someone then proposed, well, what if I'm just shaking my head like I'm upset? Well, I'm like, it's all about the context of it, where if you got hit really hard, someone doesn't, again, like instead of wondering if they had a concussion, if they get up, shake their head, and it looked terrible, then that's a concussion. I don't really care what you say afterwards, right? Like, or the situation. It's just like that's a concussion, you're out. Just like if I saw your your knee go all the way over and then back. It's like you hurt yourself, so that's not debatable. And so I think those type of things are trying to show and maybe empower more observers and people that don't feel like they have a medical education or medical training on it. But I think that was a perfect example of just something so basic that if I as a parent knowing nothing else saw that article and I saw my kid do that, I'd say he's not going back in the game. I don't care what you guys say, right? And then I want him fully checked out, which is not possible on the sideline, right? And so that idea, I think, too, is just all people being part of it. And one of my biggest pet peeves is when I hear everyone kind of put so much onus on them coming to see me, even from the school aspect, right? They'll say like, "Oh, well, he didn't go to school because the school said wait till you tell us what to do." And I go, "Well, I'm not a educator. Like, I haven't been trained as an educator. I don't know how to exactly what classes does he have? What's his day like? What's this and what's affected and what can I do? Can I print off the do I have a printer that I can print off the papers for him? Like I don't know any of that stuff. So how do I say do that? I can say he has a concussion and he needs accommodations, but I can't do that piece of it. And the same thing, I guess, for parents is advocating for their kid that if they see that they're off, it doesn't matter if the doctor is like, oh yeah, he's fine, or the coach is like, oh, he needs to play. If you don't feel he's good or she's good, then wait. And it's always better to be safe than sorry in those situations. And while we don't have great technology to say, again, buying time can be very helpful and prevent very significant issues because we give it a full time to heal. And I don't think enough people put that into context that it's very much like a broken bone that if I was like, it might be all the way healed, you probably aren't going to want to play or no one wants to risk that. And this is your brain versus your pinky finger. And so trying to at least have like a basis of understanding of that, I think is one of the most important things that I can see. And then again, I think knowing in each of those situations where, in conferences, even the brain talk one that we did, hearing everyone else's opinion and gathering information and understanding of situations from all those angles, I think is very helpful too. So trying to ask if your kid is in those situations, what's happened before, what are they trying to do in schools or the athletic departments, that sort of thing, to best set up your patient.
Absolutely. Well, thank you. This is the part where we dive into a little more light conversation. I'm going to ask you the candid questionnaire.
Okay.
So, first question, what's one word your friends would use to describe you?
Uh, the one that I get the most is baby whisperer. Um, I think. I think it's because babies and I have more of like maybe my intellect is on a baby's level of I can be like them.
Well,
I think I've always really enjoyed interacting with young kids, and I find it a challenge to um, help them be calm and understanding of situations. So that's one thing that I've always been commented about, and having a 2 year old, almost 2 year old right now, then I'm in that phase of I debate if I'm actually good at it anymore because she just challenges a little bit every day. Um, but yeah, that's maybe something that my parents taught me well how to having younger siblings too, trying to take care of them.
are you the oldest?
I'm the second one, so I actually have to give a lot of credit to my sister because I think she taught me how to be patient because she was patient with me.
But you just your demeanor, like you have this very calm spirit and energy about you anyways. I think that would translate well with babies.
Yeah, I know. Like I always tell people because like parents will, like kids will scream or whatever, and I'll be like, like it doesn't bother me one bit. Like I'm used to
Super patient. Well, I think that's
it.
a very important aspect when you're in the pediatric space. Number two, if you could instantly master any sport or physical skill, what would it be and why?
So baseball is what I grew up loving and pitching specifically. So I think being able to like have that down packed, um, just because I worked so much on it and now I work with my son on it. Like I think just being able to fully understand the biomechanics of that would be that and hitting obviously, but just kind of understanding the nuances of that because there's a lot of nuances that are there that I've heard, again, getting different people's perspectives where you were taught one way and then someone comes along and says something that's like, no, you do the opposite of that. It has always been interesting to hear too.
Do you or in is it Little League that your son is
Yeah,
playing?
yeah,
Okay. Do they do anything about like letting you as parents know about concussion? Is there a paper to sign or a
yeah, yeah.
insert
Actually,
to send?
there's a little bit of that. And actually, the Lexington County they require all the coaches to do a training. There's again, I can unfortunately tell bad stories about that and good stories, but they made me do the training, so I do feel like they at least uphold that. So
As
the
a
training
parent, they make
as a
parents
coach,
do it,
the coach.
but you're a coach for them?
Yes, yeah,
Okay, okay.
yeah. Um, so as the coach, I still had to do the training, even though they know I'm the quote unquote concussion expert in town, and it's the basic CDC one. But I think that's again where at least it opens up that conversation where the requirement is there. So I think the whole point is that it is an injury that while we could get into a lot of the overuse injuries and stuff in baseball, the brain is something special. So let's um, not ignore those type of possible injuries.
I love that they made you take the training. How was it? How would you grade it
Yeah.
for efficiency, adequacy?
Yeah, I mean, it was adequate enough to understand the idea that concussions exist and thinking through that idea that it can come out later and then how we should respond to it of you know seeking medical care and let's assume it's a concussion, not well, you're probably fine. Why don't you just go back in and we'll check it later type thing.
Okay. Was that something that you had to go to a space for, or was it something you could do online?
It was online from the CDC.
Okay. Number three, what's one activity or hobby you find most relaxing or beneficial to your brain?
Hmm. To my brain specifically, huh?
Yeah.
I don't know. I mean, I do find that like to my brain because I feel like it's always working in this space too. I think when I can really sit there and read a good article or information about concussion, it really helps me because I know that there's we're making progress and we're getting there. So like anytime reading even about things like this, like where things are getting done in this space that can then add up to something, I feel like really relaxes my brain because it really is constantly trying to think through what just a lot of the questions we asked today.
Yeah, that's so interesting. I'm the opposite. Like when I start reading articles or studying, like that ramps
Yeah,
me up. It makes me want to get
yeah,
into the office and start
yeah,
sending off
yeah,
emails and coming up with plans.
yeah. And maybe I mean it calms me of like yeah, maybe it's like a different type of calm because I've always not been the one to like maybe again that's why babies and I get along because I'm more of a just like just chill like just not really doing anything to relax versus reading just kind of like sets me in the right tone is I get maybe tone is maybe the better word than relax but
Okay. What is the weirdest or most unexpected item in your bag or car right now?
huh weird or unexpected um I mean I do keep a lot of interesting things in my car just from trying to have medical supplies available in case things go on. So I do have like those ice packs that you can burst and like turns into cold stuff. I know people always kind of like when they see that in my car, they're like, "What is this?" But that's again just trying to think if someone does get hurt, it's nice to have something available because if I'm just there, you can't really help them. Like, right? You need like supplies and equipment to be of benefit. It's not like me just patting them on the head is gonna do anything. So, like, is a doctor here? It's like, yeah, but I don't have anything, so I don't know what you want.
I think that's fantastic because, of course, you always think about in the movies where they're like, "Is there a doctor in the house?" And
Yeah,
you're like,
yeah,
"Yes, but I have no equipment, no
yeah,
supplies."
yeah. I have knowledge of stuff, but like I need this or that to help you, like a splint or something. So
I think that's so proactive.
yeah,
Well, I mean, could you even call that unexpected? I mean, you're a doctor.
yeah. I don't know.
Well, I think that's cool. It's not something that the average person is going to have in their
Right.
car. Okay, last, what is your go-to guilty pleasure TV show, movie, or song?
Um, I feel like right now it's Mickey Mouse Clubhouse just because that's all my daughter wants to listen to. So I feel like I've watched more Mickey Mouse Clubhouse than any other show recently. It's something that's just to appease her of because she seems to really enjoy that.
Mickey Mouse Clubhouse.
Yeah.
Okay, that is a first on the show. Okay, that's all 5 questions. Thank you so much.
Yeah.
This was fantastic. I feel like I could talk to you for hours, and I'm looking at the clock. Like normally I try to do an hour, but you just have such wonderful things to say. And I definitely want to connect because I too am looking to see how I can help and make change in regards to legislation. So
Yeah.
glad that you've got
Yeah.
some leeway on that because I'm going to need some guidance on what to do with that.
Yeah. And like you said, there's so many layers to it to, policies that are already out there, but making sure people understand parts of that versus and we even realized that we were going after a lot of changes when we realized we should probably start with some basic ones like that have to be done and then a layer on top of that of a bigger picture and a more all-inclusive approach.
Absolutely. Well, thank you so much, Dr. Jeff
Yes.
Holloway, for taking the time this morning. And hopefully, we'll have you back on because this conversation can absolutely continue.
Yes, absolutely.
All right. Thank you and have a great day.
All right, you too.
And that wraps up another powerful episode of Candid Conversations with Dr. Kelly. A huge thank you to Dr. Holloway for sharing his insight and expertise on pediatric concussion. Such an important and often overlooked topic. But guess what? The conversation doesn't stop here. If you want access to behind the scenes real talk, where Dr. Holloway and I dive deeper, swap stories, and talk shop, then you won't want to miss the exclusive bonus content available now on my Patreon. Join me over there for extended conversations, unfiltered moments, and a closer look into the world of brain health and beyond. Head to patreon.com/Dr. Kelly and join my Patreon family today. Your support helps keep these important conversations going and growing. Until next time, stay informed, stay empowered, and as always, keep it candid.